All right, for primary secondary survey, to start, we want to check the environment as we're approaching. We want to make sure that there's no firewire, gas glass, anything that could hurt me. We want to be wearing our TPE, so gloves, and have our CPR mask. And as we're approaching the athlete, we want to be looking for any reasoning, maybe if there's an MOI, if we know that, or any signs just from the athlete, if there's any issues, obvious issues that we can see just even approaching. We want to approach from the head, or from the feet, sorry, so that she can look at me without moving her head. So I'm going to come up, and if there's a suspected spinal, if you know that there isn't a possibility of spinal, this isn't as important. But if you think that there might be, you want to come up and say, hey, please don't move. I'm Madison, I'm a sport first responder. Can I help you? So you're asking for consent?
Yes.
Yes? Awesome. I can help her. So first, her speaking back to me actually clears both her airway and her breathing, because that means that she can get air through her throat and speak to me. So airway, breathing, and you also want to check circulation, so you can just check circulation with radial pulse with your fingers as you're talking to her. You also check the carotid, and now you want to see if there's any deadly bleeding, so you can just scan with your eyes, see if there's any obvious bleeding. You can also feel with your gloves underneath her sides, see if there's any blood there on your gloves. Nope, great, awesome. So no deadly bleeding. If she was unconscious, we could also do a head tilt chin lift, make sure the mouth guard's out of the mouth, and lean down. And if you feel or you hear any breathing, that's a sign that she's breathing. Also, you can watch her chest rise and fall. You can count how many respiratory or like breaths she's taking, respiratory rate. You also want to clear C-spine right here. So if she's conscious, great. She's talking to me, that means she is conscious. And clearing C-spine, I want to ask if she has any tingles down into her arms, anything like that, down into the legs. Nope.
Nope.
Awesome. And you could even just see, do you know what finger I'm touching?
Yes.
Can you feel that?
Yes.
Which one is it?
The pointer.
Nice. You can also do the same with the toes. If you had somebody else down there, they could touch a toe. Ask what toe they're touching, if they feel that, and check that. You can also feel through the neck if there's any midline tenderness. That could be a sign of a spinal. She doesn't have any, so it's great. And if she feels okay, I can actually remove my hand and ask her, can you turn your head slowly to the right, almost like you're shoulder checking?
Yes.
Yes? And then turn towards me. That's okay too?
Yes.
Or if you're still unsure about it, you can also keep your hand there and actually have her, can you look at my finger? So that's engaging the neck muscles. Can you look at my finger? Awesome. So cleared C-spine there. So now we can move on to secondary survey, because there's no obvious life-threatening things. If there was, we call EMS. If she was having trouble with her ABCs, we could also call 911, get an AED. Now we'll move on to secondary survey, so we'll check vitals, so that could be blood pressure, pulse, respiratory rate, skin color, temperature, pupils. So pulse, you can just check the carotid, or the radial pulse of the carotid. Blood pressure, you can also assume from the pulse, based on if they have a pulse here versus the carotid, it's a different value. Check pupils, are they even? You can also get a pen light, you can check whether or not they react the same. Skin color, you can tell, is it cool, clammy, is it like a weird color, anything like that. And then you can move on to asking if she's conscious. Samples, so signs and symptoms, allergies, medications, past injuries, has she ever heard anything before, last oral intake, and events leading up to the injury. And also, if she has a specific pain, you could go OPQRS, so onset, what was the MOI, what causes the pain, what movements cause the pain, provoking, does moving the joint or whatever that hurts cause more pain, quality, so staking or stabbing, aching, tingling, burning, anything like that, dull, sharp. Then you can move on to severity. How bad is it, 1 to 10? Radiating, does it radiate down into, like, say, a shoulder? Does it radiate down into the arm or across the chest? And time, how long has it been hurting? Does it come on and off? How does it feel? Okay, now we'll move on to our head to toe scan. So we want to check our head first. So you can kind of feel along the head, see if there's any like obvious bony deformities, any cranial fractures. No, feels okay, great. We also look for battle signs, raccoon eyes, any fluid leaking anywhere. Make sure that there's no like spinal cord injuries, like that. Now we can move down into the neck. Any midline tenderness? Is there any like obvious muscle tone issues? Is there muscle spasms through there? Kind of feel through the neck. And also check jugular distension and if there's any tracheal deviation. Moving down into the shoulders, press along the collarbone and along the spine of the scapula. Is there any pain with that? Feel down over the head of the humerus, down the humerus, down through the ulnar radius, and then into the hand. Now we can check the chest. Coming along the rib cage, is there any pain with me squeezing, seeing if there's any fractures or any like obvious like weird noise like flapping or anything. I also want to feel along the sternum, see if there's any fractures there. Now into the abdomen, you want to check if there's any like distension, if there's any guarding, anything like that, the 4 quadrants. Moving down into the pelvis, you can compress along the pelvis, see if there's any pain through there, and also check for incontinence or bowel issues, because that could indicate a spinal injury. And then compress down the femur, get to the knee, you can feel around the patella, through the sides of the fibular head, the tibial tuberosities and femur attachments, and then down through the calf, feeling along the tibia and fibula, see if there's any obvious issues, compressing through, seeing if there's any fractures, down to the ankle, feel along the malleoli, if there's any pain there, and then through the navicular and the 5th metatarsal, if there's any pain there, and through the foot, all feels good. Yeah, if there's any place that really caused pain or was an injury, then you can go back and do more tests. If it was a really bad injury, but we felt like we could move her, we could have her say it's a shoulder, hey, can you hold your arm? Can you hold it yourself? Yeah? Yeah. Can you hold it up? Yep. And then, do you feel like you can sit up? Awesome. So I can help her sit up. And then if she feels good, then we can get her up and walking off the field. And then we can do another assessment on the sidelines. Thanks.